Hello friend, today I'm going to tell you about epilepsy. In this video we will cover Introduction, Symptoms, Causes, Complication, Risk Factor, When to see a doctor, Treatment. So let's get started. Epilepsy. Epilepsy is a central nervous system, neurological, disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy. Epilepsy affects both males and females of all races, ethnic backgrounds and ages. Symptoms. Epilepsy is caused by abnormal activity in the brain. Seizures can affect any process your brain coordinates. Seizure signs and symptoms may include temporary confusion, a staring spell, stiff muscles, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness. Psychological symptoms such as fear, anxiety, or déjà vu. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Doctors generally classify seizures as either focal or generalized, based on how and where the abnormal brain activity begins. Movements. These seizures usually affect the neck, face, and arms. Myoclonic seizures. Myoclonic seizures usually appear as sudden brief jerks or twitches and usually affect the upper body, arms and legs. Tonic-clonic seizures. Tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of epileptic seizure. They can cause an abrupt loss of consciousness and body stiffening, twitching and shaking. They sometimes cause loss of bladder control or biting your tongue. Causes. Epilepsy has no identifiable cause in about half the people with the condition. In the other half, the condition may be traced to various factors, including genetic influence. Some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, run in families. In these cases, it's likely that there's a genetic influence. Researchers have linked some types of epilepsy to specific genes, but for most people, genes are only part of the cause of epilepsy. Certain genes may make a person more sensitive to environmental conditions that trigger seizures. Head trauma. Head trauma as a result of a car accident or other traumatic injury can cause epilepsy. Brain abnormalities. Abnormalities in the brain, including brain tumors or vascular malformations such as arteriovenous malformations, AVMs, and cavernous malformations, can cause epilepsy. Stroke is a leading cause of epilepsy in adults older than age 35. Infections. Meningitis, HIV, viral encephalitis, and some parasitic infections can cause epilepsy. Prenatal injury. Before birth, babies are sensitive to brain damage that could be caused by several factors, such as an infection in the mother, poor nutrition or oxygen deficiencies. This brain damage can result in epilepsy or cerebral palsy. Developmental disorders. Epilepsy can sometimes be associated with developmental disorders, such as autism. Complications. Having a seizure at certain times can lead to circumstances that are dangerous to yourself or others. Falling. If you fall during a seizure, you can injure your head or break a bone. Drowning. If you have epilepsy, you're 13 to 19 times more likely to drown while swimming or bathing than the rest of the population because of the possibility of having a seizure while in the water. Car accidents. A seizure that causes either loss of awareness or control can be dangerous if you're driving a car or operating other equipment. Many states have driver's license restrictions related to a driver's ability to control seizures and impose a minimum amount of time that a driver be seizure-free, ranging from months to years, before being allowed to drive. Pregnancy complications. Seizures during pregnancy pose dangers to both mother and baby, and certain anti-epileptic medications increase the risk of birth defects. If you have epilepsy and you're considering becoming pregnant, talk to your doctor as you plan your pregnancy. Most women with epilepsy can become pregnant and have healthy babies. You'll need to be carefully monitored throughout pregnancy, and medications may need to be adjusted. It's very important that you work with your doctor to plan your pregnancy. Risk factors. Certain factors may increase your risk of epilepsy. Age. The onset of epilepsy is most common in children and older adults, but the condition can occur at any age. Family history. If you have a family history of epilepsy, you may be at an increased risk of developing a seizure disorder. Head injuries. Head injuries are responsible for some cases of epilepsy. You can reduce your risk by wearing a seat belt while riding in a car and by wearing a helmet while bicycling, skiing, riding a motorcycle or engaging in other activities with a high risk of head injury. Stroke and other vascular diseases. Stroke and other blood vessel, vascular, diseases can lead to brain damage that may trigger epilepsy. You can take a number of steps to reduce your risk of these diseases, including limiting your intake of alcohol and avoiding cigarettes, eating a healthy diet, and exercising regularly. Dementia. Dementia can increase the risk of epilepsy in older adults. Brain infections. Infections such as meningitis, which causes inflammation in your brain or spinal cord, can increase your risk. Seizures in childhood. High fevers in childhood can sometimes be associated with seizures. Children who have seizures due to high fevers generally won't develop epilepsy. The risk of epilepsy increases if a child has a long fever-associated seizure, another nervous system condition, or a family history of epilepsy. When to see a doctor. Seek immediate medical help if any of the following occurs. The seizure lasts more than 5 minutes. Breathing or consciousness doesn't return after the seizure stops. A second seizure follows immediately. You have a high fever. You're pregnant. You have diabetes. You've injured yourself during the seizure. You continue to have seizures even though you've been taking anti-seizure medication. Homeopathic medicines for epilepsy. Artemisia vulgaris, Chamomilla, belladonna, Nux vomica, Bufo rana. Conium. Plumbum metallicum. Thanks for watching. Doctor Online 24/7. By Dr. Sana Bawani.